All right, so we are looking at lower extremity evaluation with an emphasis on a whole person approach and the kinetic chain of the lower extremity. So first off, I'd like to introduce myself. I am Megan Bibler, a member of the Indiana State Doctorate in Athletic Training program. I am currently in my second semester out of 6 for the program. So we have been looking at evaluations and also really focusing on lower extremity this semester. So this is my self-reflection of my evaluation and what I can do to help improve the gaps of that. So first off, for my introduction to any patient, my goal is to get the patient to be comfortable with me. For what works best for me is a nice smiling big handshake and also letting them make a connection with me through either a sport or I like to make a joke just to really get the patient comfortable because if I'm focusing on the whole person approach to the injury, then I need them to be really comfortable with me. I need them to have their trust in me, and I want to look at not just their injury, but them themselves. So then after I make the connection and introduction, I go on to my typical evaluation. So I get their history, I do palpation, range of motion, manual muscle test, special test, and then by the end of that, I usually have a good grip on what I think the injury is. But that's not always knowing the mechanism. So with acute injuries, after I go through my typical evaluation, I usually know what the mechanism was because it's acute. The patient usually recalls the exact moment the injury happens. And then I also pretty much have a clue what I think the injury could be. But the things that gets a little bit tricky is the chronic injuries. So chronic injuries, during my typical evaluation, I can usually get a good sense of what the injury is. But the typical evaluation doesn't allow me to really focus on what I think the mechanism is. And I think this is where a lot of people kind of end up just saying, yeah, this is what you have, and here are a few exercises that can help the pain, but really they don't focus on correcting what is actually going wrong with the patient. Luckily enough, I had a professor who loved gait analysis at my undergrad at Ball State University. And so she took us through gait analysis over and over again, and we have that stuck in our head. So if I have a patient who has chronic, let's say low back pain, I can look at I will check their gait. I will have them walk back and forth. I will have them stand on one leg, see if they have a Trendelenburg sign, see what kind of muscle imbalances they have. So I feel very confident in my gait analysis and seeing if they have a drop foot, a hike in their hip, if they swing their leg around. I also, if I'm not getting anything with the gait analysis, they look pretty normal, then I check their posture. So typically what I see in posture is rounded shoulders, forward head, and I do great with that. I do great with saying, okay, this is what your issue is, but what I will talk about later and I can talk about right now is that I know what the issue is. I just sometimes don't know how to fix that and make them not just do exercises twice or 3 times a week in the athletic training room, but really make them focus on making huge changes and breaking the habit. So next, if I'm not getting anywhere with gait analysis or posture, which typically I will see something at least, I check hip alignment in my patients, and like I'm going to revert back to my gaps. Um, I'm great at saying, yeah, you have a upslip on the right side, but I'm not that great of saying, okay, this is what you need to do every single day to get this core tight. I know the exercises, but I'm lacking either the evidence or I guess the way I describe to my patients, like, hey, you need to do this every day to make this really work. I can set you back in place, but with muscle energy, but I also need to give you exercises that you'll do day in and day out to help that fix that. And then I also focus on the balance of my patients, so seeing if they have any neuromuscular control issues. But I'm saying all this, I'm saying, yeah, this is what I do when I have a chronic, this is what I know what to do, but I don't know if this is my actual, I can't say this is my actual daily habit for every single evaluation. But when I do have to take a patient through these things, I do feel confident in making sure we're looking at what issues could be going on and diagnosing those issues. But like I said, my gaps in the evaluation. So breaking the habit, I don't know. I think I'm working with high schoolers, so I don't know if they just don't fully comprehend that you need to work hard at this, and this is just, I can't just like stretch your back out and it be okay. You really need to do some things. So I need to find a way to break the habit and create long-term changes. And then I also, with one of the articles, well, actually just one of my limitations with lower extremity and pretty much any extremity, I guess, is that I did not ever work well with preventative programs in my undergrad. So I wanted to look at what lower extremity preventative program that I could put in to action for my athletes. So I found a couple articles. Two of them focused on, actually three of them really focused on, diagnosing the issue and then how you can change that. So I have balanced training for neuromuscular control and performance enhancement. So this article focused on, yes, we do balance training, but is it effective or not? And that's like what my main question is. So they found out that balance training it works well with if you're like trying to improve static balance, but how often are we trying to just improve static balance? And they found out that balance training with strength gains is more, like strength gains are more effective. Forward shoulder postural control and collegiate swimmers. I really enjoyed this article because it took me through a lot of exercises that you can work on with forward shoulder, which I see a lot of that. I mean, I have forward shoulder, so it took me through those exercises. It showed the validity of them, and I think I got a lot out of that article, and at least now I am more aware of how I can control that posture. And I know that this is lower extremity, but I think that posture plays a huge role in lower extremity. So if I have rounded shoulders, I'm pulling on my back muscles, which then are taking place and switching up what my gait is. So I think this is relevant to that. And then muscle activation and movement patterns and prone hip extension exercise in women. I have a lot of high school athletes who I do not think activate their muscles correctly and just don't know how to control their body and their lower extremity. So I really wanted to find an article that took me through the activation patterns and how I can recognize that. And so this definitely opened my eyes. And then I looked at a 3-month jump landing training program. And this was more focused on the feasibility of it because, yeah, I've learned a lot about preventative programs, but I know the reality of me working at high school if these kids are going to come in, if the coaches are really going to care that much. And so this article opened up my eyes to that, and they actually had a lot of coaches work well with this program and implement it into practices. So these all 4 articles will definitely help me improve my lower extremity evaluations, not only evaluations, but I guess treatments more so. So making a change, I guess what I really want to get out of this assignment is not just to do the assignment and then forget about it. I need to do self-reflections more often, search the literature, and then also just continue my education, which I am doing with this doctorate program. But I just need to focus more on the self-reflections and searching the literature because this assignment has been really helpful for my lower extremity evaluation. So thank you.